Hello, I'm Dr. Dan Beelan, and this is the Alpha Site 9000 Introduction to AlphaView 2.0, the next report generating software. It's a clear upgrade to improved analysis in functional physiology and disease. So let's show you on a brief tour. So we have these 6 pages, not 7, and we have a condensation, so to speak, of the signatures on the 3rd page. The first page has the ease of reading of the priorities. We've improved the way that it looks, and so it's easier to read. The second shows the first measurement only in comparison to the ideal, and we colorated those abnormalities of the first measurements. Then we have on the 3rd page the same signatures and their severities, but we also have the indications of each regional chaos or ordering. So we all don't want chaos in every region of the body, and where we see there's abnormalities, that's very important to us. Then the next page is the breast page, which has 3 incredible and new enhancements. There can be certain points that are behaving together in a certain region, like at 3 o'clock and 3:30 and 2:30. There might be some similarly behaving points that are abnormal. So we have a new classification of that, constructing a new criteria. So now we have 13 criteria for suspicion to the breast. And then on the dental page, we have a new identifying mark, which is one tooth that's behaving in a different way. In other words, if it behaves paradoxically when its neighbors are all ideal, or when it behaves ideal when its neighbors are all paradox, we want to be able to see that. So we have a new coding for that. Plus we have a new tooth chart where you can refer immediately to the connected organ and system. And then we have our same data page. So in our additions, we have the delta change from first to second. That's 85% of what's important in regulation thermography. The first temperatures alone are just like the infrared camera, but the infrared camera, because it doesn't see the dynamics and then turn them into mathematical values and then use them through algorithms, they are missing much of what we can finally discern. In order to validate the data does come from the first measurement, we have added a full body mapping of the first measurement. So we have found numerous cases whereby there was clues in the first measurements. And so it's usually warmth in the first measurements, different than the rest of the body. And so we colorated the body. And you can see that here, before and after deviations on the baseline. And you can see in that clavicular region, the red, as well as you do in a few other areas. That's all based upon the first measurement, that left part of the body diagram. And of course we have the same differential in the second diagram. So we're able to actually colorate and make a map of those points so that we can look at their relationships to our final decision. Then you can see that here. So many of the same areas that are red might be black. Those are most important. So that gives you a whole other view, and you can see where these are derived, these warmer points looking more red or orange than the white points that are ideal, or the blue points in the first measurement of the AlphaView 2 are cold. Here again, we then tell you what points have an initial cold or an initial warm. And then with the differential, as always, we have the block points and the paradox points, which are mostly identifying inflammation. Here on our next page, where we identify all the strengths of the signature patterns or the algorithmic identification of organ problems, we can not only see that, but then we evaluate the amount of order and disorder that's occurring before and after the cool air stress, because an area that remains in disorder is more vulnerable than one that goes into order. And in this case, you can see in area 3, the disorder index A before cooling goes higher from 4.6 to 6.0 in the disorder index B, or equivalent to chaos index in the old regulation thermography texts. So this helps us identify vulnerable areas. Then on the tooth page, we have this new diagonal line. And as you can see in the lower right, that one tooth, number 4, which is also number 15 in European or Canadian, is paradox. It's getting colder instead of warmer, where all the other teeth in the region are getting warmer. And so they are either not marked on the map, or they might have dots sometimes having to do with gum disease. But here you can see there is a diagonal line on tooth number 4 and also on tooth number 7, which also has the speckled look, which means that there are two temperatures very different from each other in teeth next to each other. So now we have an added algorithm for this tooth, and we call it the divergent tooth because it's like a sore thumb sticking out that's different than its neighbors. And so if it were like this tooth number 7, that is both speckled and has the diagonal lines, that's the highest degree of suspicion that can happen in a tooth. So here we are, you can see this one with the speckled look and the diagonal look. This is the most important. And then we look at the whole quadrants. We outline that in the yellow color as being stressed to those quadrants. Here in our tooth chart, we not only have the classical tooth chart with some upgrades to some of the things like acupuncture, Chinese medicine, wood, element, metal, water, fire, but we have the alpha point connections. So it tells us, oh, does this tooth number 2 have a connection to the stomach point or to the maxillary sinus 1 point on the right? So you can see how we measure points and how those can relate through the meridian system back to the teeth, and then in a retro fashion as well, from the organ to the tooth and from the tooth to the organ. So here we also now are indicating the amount of asymmetry between the two sides. Here at first is 0.5. 0.5 is when it starts to be significant. 0.3 and 0.4 are not so significant. And here, so we have the first measurement on the left side. That additional first measurement can help us with the breast if we see hot areas or cold areas. And then we have the side difference that's digitized, so we can see how much of a side difference, so we don't have to keep looking back at the chart. And then we have the little map of all the points and where on the breast they relate to. Here is our new algorithm, which is called tuples, or they're calling regional disturbances. And if there are 2 or 3 points that are close to each other that are deviating from normal behavior, they are usually warmer, and they do not come way down into the yellow background. They're for some reason not cooling, and when they're grouped together, they're much more significant than if it's just a one-off. So, and then we see how severe is that differential of that behavior, and we classify it according to color, and the dark red is severe, and in this case on the left breast is moderate, and on the right breast is yellow, is minimal. So here we see in the breast itself, you can see on that right side, which is the left breast, that D and D1 and even C1 are coming up instead of going down in the stepwise down pattern. So those are deviating, and that evolves that dotted orange look in the coloration model of the breast, and then we name those points. This is a new criteria. It constitutes the 13th criteria of suspicion. Very, very important. So you can see on the criteria, the 13th, and in this case, the pre-stress deviation. So that gets an X with this one. 0 to 5 is low suspicion, 6 is borderline, 7 to 8 is bringing up a suspicion, 9 to 10 is high suspicion, and then the arrows on the right are showing you where those tuple abnormality groups of points are. So the summary is the ease of read, improvements to a lot of the wording and some of the algorithms. Then we have the first measurement in both the breast and the body, showing us some very crucial points often referred in infrared camera methods. This has both. And then we see the algorithmic degree of stress of the signature patterns. And then we have the chaos indicator. We then have the 13th criteria of the breast and the side difference, as well as the mapping. And then we have in the teeth the new sore thumb or dissonant tooth, and with a tooth chart. And of course, we still need our raw data chart for reference. I thank you very much for coming, and please use your device. It's crucial. You can see causes, you can see relationships, and you can see where the body is tending to go, and when you're treating, where the tendencies are in healing, and also how effective your therapies have been. Thank you very much for joining us. You can contact us at info@alphatherma.com or call us at 866-652-6600. Internationally, 831-245-0588. We're at